Attention Deficit Hyperactivity Disorder by Lucas Pigeon. Biological and cognitive issues. Biological issues include scientists have discovered that there are three differences in the brain, nerve networks, and neurotransmitters of those suffering with ADHD and those who are not. The frontal lobe is responsible for planning, paying attention, making decisions, and using language to moderate behavior. Scientists have found that the brain of individuals suffering from ADHD tends to fully develop later than an individual who is not. Cognitive issues. People suffering from ADHD can have trouble managing their behavior, paying attention, controlling their activity, regulating their mood, staying organized, concentrating, following directions, and even sitting still. Social issues. Individuals suffering from ADHD can deal with social issues throughout all various age groups. When children with ADHD enter a social setting, they may have a hard time sharing, taking turns, listening, and picking up on social cues. They may also have a hard time staying focused and motivated in school. Oftentimes, students suffering from ADHD get bored, uninterested, or check out of the conversation early. This could lead to a decline in grades or even social friend groups. Adults suffering from ADHD are often affected by work by their disorder. This can lead to financial issues as well as a decline in mental health. Individuals with ADHD often experience social difficulties, social rejection, and interpersonal relationship problems as a result of their inattention, impulsivity, and hyperactivity. Such negative interpersonal outcomes cause emotional pain and suffering to the individual. Psychological issues. Automatic attention is the kind of attention you use when you're doing something that's interesting or engaging. Directed attention is the kind of attention you use when you must do something that's tiring or of low interest. For example, boring repetitive tasks. People suffering from ADHD tend to have much less capability for directed attention. This makes the psychological processing of what could be considered common day-to-day activities much harder on individuals suffering from ADHD. Clinical features. ADHD is most commonly diagnosed among children. There are 4 different types of ADHD: predominantly inattentive presentation, predominantly hyperactive impulsive presentation, combined presentation, and unspecified presentation. Until 1994, people called the inattentive presentation type of ADHD attention deficit disorder, or ADD for short. The American Psychiatric Association officially changed its name. Now all forms are referred to as ADHD, whether symptoms are hyperactive are present or not. The different types of ADHD can be diagnosed through the examination of specific symptoms. A typical diagnosis takes place when symptoms have interfered with the process of at least 2 areas of life and have occurred for at least the past 6 months. Predominantly inattentive presentation. Some symptoms may include trouble paying attention to details or making careless mistakes, issues remaining focused on tasks and activities, difficulty listening well, daydreaming or seeming distracted, trouble following instructions and or finishing tasks, difficulty with organizing tasks and activities, avoiding or disliking tasks that require continuous mental effort, losing things frequently, being easily distracted by outside stimuli, forgetful in daily activities. Predominantly hyperactive impulsive presentation. Some symptoms may include fidgeting with or tapping hands or feet or squirming frequently, leaving their seat when remaining seated is expected, sporadic movement when it's not appropriate, trouble engaging in leisure activities quietly, always seeming on the go or driven by a motor, talking too much, constant interruption of others, frequent trouble waiting for their turn, often intruding on others' activities or games. Combined presentation. People with combined type display behaviors from both attentive and hyperactive impulsive categories. According to the DSM-5, children must display at least 12 of the total behaviors, at least 6 inattentive behaviors, and 6 hyperactive/compulsive behaviors. Unspecified presentation. In these cases, symptoms may be so severe that children clearly demonstrate dysfunction but don't meet official symptom criteria for a diagnosis of ADHD inattentive, hyperactive, impulsive, or combined type. In such cases, providers assign unspecified ADHD as the diagnosis. Etiology, Part 1. The exact cause of attention deficit hyperactivity disorder is not fully understood, although a combination of factors is thought to be responsible. Current research shows that genetics play a vital role in the development of ADHD. This means that ADHD often runs in the families and is biological. Nerve cells called neurons transmit signals to your brain. These signals travel through your brain in groups of neurons called networks. Researchers have found that some major networks work differently in people with ADHD. Scientists have identified a number of possible differences in the brains of people suffering from ADHD than those without the condition, although the exact significance of these is not clear. For example, studies involving brain scans have suggested that certain areas of the brain may be similar in people with ADHD, whereas other areas may be not similar. Other studies have shown that individuals suffering from ADHD may have an imbalance in the level of neurotransmitters in the brain, or that certain chemicals may not work properly. Prevalence and incidence. ADHD is a long-term chronic brain condition that causes executive dysfunction. This means the ability of a person suffering from ADHD to manage their own thoughts, emotions, and actions are disrupted throughout the entire day. Kids usually receive a diagnosis during childhood, and in most cases, conditions last into adulthood. Thankfully, there is effective treatment possible. If left untreated, ADHD can cause serious lifelong problems and complications. According to the Centers for Disease Control and Prevention, almost 11% of U.S. children between the ages of 2 and 17 have received an ADHD diagnosis. Worldwide, 7.2% of children have received an ADHD diagnosis. Daily interruptions. Some interruptions of an individual suffering from ADHD include being easily distracted while taking an exam, fidgeting or shaking while taking an exam, trouble balancing social life with work or school, loss of train of thought, trouble focusing on a specific task, and etc. Evidence-based treatments. Different types of therapy have proven to be extremely useful when treating ADHD. Therapy is also effective in treating additional problems, such as conduct or anxiety disorders that may appear with ADHD. Along with therapy, medicine is also used to combat ADHD symptoms. There are 5 main types of medicine licensed for the treatment of ADHD. Methylphenidate, dexamphetamine, atomoxetine, and guanfacine. And I'm sorry if I said those wrong. Although these medicines are not a permanent cure for ADHD, they may help someone suffering with condition concentrate better, be less impulsive, feel calm, and learn or practice new skills. Most of these medicines need to be taken every day in order to work efficiently, although some of them can be administered on a situational basis. Methylphenidate. Methylphenidate is the most commonly used medicine for ADHD. It belongs to a group of medicines called stimulants, which work by increasing activity in the brain, particularly in areas that play a part in controlling attention and behavior. This may be offered to adults, teenagers, and children over the age of 5. List dexamphetamine. Lisdexamfetamine is a medicine that stimulates certain parts of the brain. It improves concentration, helps focus attention, and reduces impulsive behavior. It may be offered to teenagers and children over the age of 5 with ADHD if at least 6 weeks of treatment with methylphenidate has not helped. However, adults may be offered lisdexamfetamine as a first choice medicine instead of methylphenidate. Excuse me. Dexamphetamine. Dexamphetamine is similar to lisdexamfetamine and works in the same way. It may be offered to adults, teenagers, and children over the age of 5 with ADHD. Atomoxetine. Atomoxetine works differently from other ADHD medicines. It increases the amount of a chemical in the brain called noradrenaline. This chemical passes different messages between brain cells, and increasing it can aid concentration and help control impulses. Guanfacine. Guanfacine acts on part of the brain to improve attention, and it also reduces blood pressure. It may be offered to teenagers and children over the age of 5 if it's not possible to use methylphenidate or lisdexamfetamine. Guanfacine should not be offered to adults with ADHD. References. And I had to screenshot that because I could not get it to format right. Thank you very much for watching my video presentation on ADHD.